Hi everyone, and welcome to this video to demonstrate the new Polar Dementia Risk Flag. This new Polar functionality has been built in collaboration with Western Victoria PHN and partner universities, and we would like to thank all our partners for their support with this project. The Polar Dementia Risk Prompt is based on the CogD Dementia Risk Assessment and follows two workflows or use cases, which we will now demonstrate. The first use case is when you would use Walrus, which is a point of care tool to help understand whether the patient who's currently in a consultation is at risk of dementia, and therefore the clinician can follow some use cases or some actions based upon that risk identification. And the second use case is when you would use the clinic summary report to identify a patient cohort based upon the flag that's captured within that report. So what we'll now do is explore both use cases and give you a demonstration. What I now have in front of me is the best practice clinical information system with a pretend patient open, Alan Abbott, and you can see here that Walrus is also open down at the bottom. What I'm going to click on is the risk button, and you can see that there's a risk here around dementia, which has been pre-calculated based upon our algorithm. The clinician now can do one of three things. They can choose to open up the CogD assessment by clicking on the button, which takes them to the website where they can do a full assessment. The second action they may choose to do is to use the URL link, which takes you to the FACE Dementia website. And lastly, what the clinician may choose to do is order some more pathology. So by clicking on a pathology button, you can see here that the pathology request screen has been opened within the clinical system. So that covers use case 1, where someone would use Walrus for the patient that's currently in a consultation. Use case 2 would involve using the clinic summary report. Let me just minimize Walrus. So the clinic summary report in this instance here has a patient menu. If I click on the patient menu, you can see that there's filters, and there's a filter dedicated to dementia risk. By selecting on that, you'll be able to choose yes. This now shows that there are 2 patients within the practice that have a risk of dementia. And of course, you can produce a patient list to review those patients. So regardless of which option you use or use case, whether it's be Walrus or the clinic summary report, it's using the same algorithm to identify patients that are at risk of dementia. So please note that the dementia risk flag is only provided as a guide and is not intended to replace a health professional's clinical judgment when making a clinical diagnosis about a patient's treatment. It is important to note that this identified risk is intended to reflect their current risk and is not reflective of their prior care. I hope you've enjoyed this video, and I hope you enjoy using a dementia risk flag when it gets to your practice. Thank you, and bye.